Menisci. The menisci are fibrocartilaginous discs with a semicircular shape. The congruency between the femoral condyles and the tibial plateau is improved by the medial and the lateral menisci. The arrangement of meniscal fibers allows axial load to be dispersed in radial direction. The menisci are located on top of the tibial condyles, covering the articular surface of the tibial plateau. Both the menisci are open towards the intercondylar tubercles. They are thick peripherally and thin centrally. The medial meniscus is C-shaped in structure and the lateral meniscus forms 4/5 of a circle. The lateral meniscus covers a greater percentage of the small lateral tibial surface than the surface covered by the medial meniscus. Greater degrees of genu varum results in greater compression of the medial meniscus. So the hip joint, the knee joint and the ankle joint in genu varum. So in genu varum, the ankle joints move towards the midline of the body. So the medial meniscus undergoes a greater compression as compared to the lateral meniscus in genu varum. Let's see the meniscal attachments. The first one is the transverse ligament. It connects both the menisci to each other anteriorly. So we have the medial meniscus and the lateral meniscus, the anterior portion and the posterior portion, and this is the transverse ligament. Then we have the patellomeniscal ligament. It attaches the menisci to the patella. Then we have the coronary ligaments which attaches the menisci to the tibial plateau. The fourth one is the medial collateral ligament or the MCL which attaches the medial meniscus to the joint capsule. Then the anterior cruciate ligament and the posterior cruciate ligament which attaches the anterior and the posterior horns of the medial meniscus. Then we have the semimembranosus muscle which attaches the medial meniscus. The open anterior and posterior ends of the menisci are called the anterior and the posterior horns. Which meniscus is bigger and how to remember? The medial meniscus is bigger as compared to the lateral meniscus. You can remember the term CM. So C stands for circular and M stands for medial. So remember that the medial meniscus is circular in shape and CM as in chief minister. So you need to remember that the CM is the greatest person. So in other words, M for medial meniscus and C for circular in shape, this medial meniscus is the greatest, or it means that the medial meniscus is bigger than the lateral meniscus. Which meniscus is more prone to breakage and why? The medial meniscus is more prone to breakage. As previously discussed, since the medial meniscus is larger than the lateral meniscus, the amount of movement of the medial meniscus is restricted. Therefore, it is more prone to breakage. Secondly, the medial meniscus has more attachments than the lateral meniscus. Therefore, translation is limited. The attachments are the transverse ligament, the patellomeniscal ligament, the coronary ligament, the medial collateral ligament, the anterior cruciate and the posterior cruciate ligament, and the semimembranosus muscle. Thirdly, the medial femoral condyle is more susceptible to injury due to greater compressive loads. Therefore, the medial meniscus bears more weight. As a result, it is more prone to break. And lastly, in genu valgum, the medial meniscus undergoes greater compression as compared to the lateral meniscus, As a result, the medial meniscus is more prone to breakage. Role of the menisci. It provides stability, increases joint congruency, helps in weight bearing, reduces friction, and helps in shock absorption by taking 50 to 60% of the body weight. The strong attachments of the menisci prevent them from being squeezed out during compression of the tibiofemoral joint. Therefore, allows greater contact area between the menisci and the femur and reduces the joint stress. During removal of meniscus, the contact area is decreased. Therefore, the joint stress increases. This damages the articular cartilage. As a result, it multiplies the forces by 6 to 7 times on the tibial plateau, further resulting in degenerative changes within the tibiofemoral joint. Therefore, total meniscectomies are rarely performed after a meniscal tear. Rather, the meniscus is preserved as much as possible through debridement or repair. Meniscal nutrition and innervation. By first year of life, the entire meniscus has blood supply. As child grows, weight bearing is initiated. Blood supply or vascularity decreases. After 50 years of age, only the peripheral two-thirds of the menisci is vascularized. Blood supply occurs in the form of capillaries, that is, in the peripheral portion. The central portion receives nutrition from synovial fluid by diffusion. Hence, healing after an injury becomes slower. The menisci are innervated by free nerve endings and three mechanoreceptors, that is, the Ruffini corpuscles, the Pacinian corpuscles, and the Golgi tendon organs.